The contribution of research in nursing. Research has led to prevention of mental illness by identifying social and environmental factors that influence mental health and well-being. The World Federation for Mental Health developed the Melbourne Charter, which is a strategy for mental health promotion and prevention of mental illness. In the past, clients living with mental illness were sent to an asylum and treated very poorly. Research in public education has substantially changed these practices. Recovery-oriented care provides clients with the necessary support and integrates them back into society. Clients have equal rights and are treated with respect.
Research in geriatric care. Pharmacokinetics is the absorption, distribution, metabolism, and excretion of medications through the body. As one ages, organ functioning decreases, which affects all these phases. Research in the elderly regarding medication interaction is crucial to nursing, as overdose or toxicity is a high risk for this population. Without research on pharmacokinetics in the elderly, there would be a lot of medication errors made, as the elderly do require less medication. Research also provides nurses with the evidence to support their care choices, such as rotating an elderly patient every 4 hours to reduce the risk of developing a pressure ulcer. Lastly, age-related illnesses for the elderly are important due to their increased risk of contracting common illnesses such as the flu. Preventative techniques such as hand sanitizer, flu shots, and education on hand hygiene can be provided.
Research is important in emergency department nursing because it can aid in the development of practice guidelines, decrease wait times in the emergency room, increase positive treatment outcomes for patients, and refine skills that are important to the emergency room nursing, for example, CPR guidelines and practices. Medication administration and making sure the medication produces its desired effects, and analyzing tests performed on patients such as x-rays, ECGs, CAT scans, MRIs, and blood work.
In public health, there is a lot of health promotion, so it's important to have the most recent research and statistics about certain subjects. For example, there are many ways to prevent chronic disease, such as changing your diet and increasing your physical activity. As a nurse, it is important to show these facts about the information to promote physical activity and healthy eating. Public health nurses also go out into the community to give vaccines and other medications. As a nurse, we are held accountable for our actions that we take part in. It is important that we as nurses know about these medications being given, such as their side effects and therapeutic dose. It is important for the nurses to be able to answer questions and give information to the clients, and this is done through research.